This is a brief demonstration of a DynaMed decisions tool from within an EHR integrated environment. If you were to use this tool outside of the EHR or without EHR integration, the look and feel of it would be largely the same, aside from expectations around the data input page, namely that with EHR integration, the user can anticipate that at least some of the fields that are necessary to run the tool will be pre-populated based on information that is available in the patient's chart. So in this case, upon launching the tool, we see a notification that the systolic blood pressure field was not pre-populated despite being a candidate for pre-population. And the reason for not being pre-populated is given here in the parentheses that follows. So in this case, this patient does not have systolic blood pressure within the last 3 months. So that is the reason why it was not pre-populated. So we can click away from that notification. And again, if you're in an EHR integrated environment, your landing page will look largely like this. And it's a notification saying that the highlighted fields are those that are candidates for EHR pre-population. And there's also a notification that any lab dates shown are the date of collection, that is the date of most interest. And if that is not available, the result date. So we see here that there are a number of fields that are candidates for pre-population, and accordingly they have been pre-populated. And as noted here, for example, total cholesterol, the lab value of 212 milligrams per deciliter is coming to us as of July 2nd of 2024. There are still some fields that need to be filled in, and these are either not candidates for EHR connection or they have not yet been EHR connected. So in this case, let's say that this person does not have dyslipidemia, although based on the pattern of total and HDL, they may be headed that way. But let's say for now that they don't currently have a diagnosis of dyslipidemia. And then for systolic blood pressure, let's say their systolic blood pressure on the visit today is 128, and they are on medication for blood pressure. We will leave the CAC score blank because, as you can see, there is no asterisk indicating that it's a required field. So required fields are noted with an asterisk. So we'll leave this blank. And that's also closer to clinical reality. A lot of people presenting don't have a CAC score for this kind of a scenario upon initial visit. And then let's say this person's self-identified race is Black. After we fill those things out, we can move on to the assessment and guidance. So this is the assessment and guidance page, and we have a lot of useful information on this page. First and foremost, there is a snapshot or synopsis of the information that was entered on the data input page, just as a helpful reminder of who we are talking about, what kind of patient. And it also serves as a visual reminder for the clinician that in case they misclick, let's say on the previous page, they had meant to say that this person was not on medication for blood pressure, this offers an opportunity for them to recognize that, go back and correct that misclick. In addition, we also have the assessment section of the tool, and we can see in this assessment section, this person's risk of a heart attack or stroke, or in clinical jargon, an atherosclerotic cardiovascular disease event over the next 10 years is about 10.6% per the pooled cohort equations. In addition, you may see these info buttons throughout the tool, and these offer additional context or nuance that can be helpful, but for whatever reason doesn't rise to the same level such that it feels warranted to forward it in the front matter of the tool. So we can click on this info button and we see that the pooled cohort equations are the equations introduced by the ACC-AHA in their 2013 guideline, with the idea that this may be helpful for folks who may not know that the pooled cohort equations come from the ACC-AHA. In addition, there is a patient chart note, and if we want to take a sneak peek at what that looks like, we can click on that. And we see here some helpful text that the user can then copy to the clipboard and then into the patient's chart by virtue of this copy button. Moving on, we see the clinical guidance section of the tool. And the neat thing about the clinical guidance section is it is highly tailored, personalized information for the patient that is being considered in this moment. And what DynaMed Decisions tools do is offer highly synthesized, personalized guidance based on appraisal and synthesis of the best available evidence and guidelines. So instead of clinicians having to read through comprehensive point of care content, or worse, combing through guidelines and studies themselves, DynaMed Decisions takes care of all of that for them and serves up, again, highly tailored, high yield, personalized guidance for the patient that they are seeing in that moment. Because we've scrolled down, you'll notice that the patient chart note button migrates with that scroll. So we think a lot about user experience. And so if the person has not yet clicked on that chart note, we don't want them to have to scroll back up in this instance. So it migrates down with them so they can have it handy there if they want to use it at that point after reading through the clinical guidance content. But since we've already seen that, let's go ahead and move forward to patient options. On the patient options page, you see that there are two subsections, key data and option grid. Before getting into what those mean, I should note that not every tool from DynaMed Decisions has a patient options page, because not every tool from DynaMed Decisions pertains to shared decision making. So for example, we also have clinical decision support tools for antibiotic management of community-acquired pneumonia, both in the inpatient and outpatient scenarios. And in those instances, shared decision-making really isn't part of the clinical course of care. Whereas in this case, statins for primary prevention of cardiovascular disease, shared decision-making is a core part of the clinical course of care. So the takeaway there is there are different tool types from DynaMed Decisions. Some are purely clinical decision support, where there is no shared decision-making component. Some clinical decision support tools have both clinical decision support and shared decision-making, like the tool that we're looking at now. And some tools from DynaMed Decisions only have shared decision-making support, because that is the key focus of that tool. So within the key data section of the patient options page, we see a risk visualization via an icon array, also sometimes called a personograph, albeit less commonly. And we can see that we have two options we can select from, no statin or statin. And in addition to giving more precise quantitative estimates, the risk visualization also allows for more of a visual gist of anticipated outcomes for the course of action that might be taken. So in this case, no statin, although you can count up 11 people in this icon array, you can also visually gather a gist from just looking at the risk visualization. If we then click into the statin option, we see now that the expectation is the statin will help about 3 of the original 11 people avoid a heart attack or stroke. And those people are indicated via a change in icon. So instead of being this orange-yellow color, they are now shifted to a gray with the orange-yellow box around them indicating what their original destiny was if they had not taken a statin. In addition, the patient chart note continues to exist within the tool. And if we've migrated this far into the tool and we click on the patient chart note evolves as we progress through the tool. So you can see now, in addition to the original text that was forwarded in the tool, we also see that there is an additional piece of text that is inserted pertaining to having a shared decision-making conversation with the patient. Additionally, although I'm not going to show it here for sake of time, if there were interest in showing this risk visualization out of 1,000 people instead of 100 people, there is a toggle here to facilitate that. And in that case, instead of people, the risk visualization will change to squares to accommodate the 1,000 denominator. Moving on now to the option grid content of the tool, we see here tabularized information that is essentially the same as what we saw on the key data section of the tool, but there is often additional information that is forwarded within the option grid that constitutes a frequently asked patient question. So for example, what does the option involve? In this case, it's fairly straightforward about the difference between statin and no statin. But in other cases, you can imagine why having an FAQ about what does the option involve being very helpful for conversations between the clinician and the patient. In addition, you can see there's a what else should I know FAQ and is a generic available FAQ. So again, mostly the same information. In terms of efficacy and harm information, you can expect that the information forwarded will be the same, but there may be additional information forwarded within the option grid that helps facilitate a conversation between the clinician and the patient by virtue of answering common questions that patients have about the decision at hand. In addition, there's a toggle for grid view or list view, and the tool is responsive to the screen size within which it is running. So in this case, it's defaulting to grid view, but if the screen size became different and, for instance, narrower, then it would at some point automatically shift over to list view to accommodate the information in the best viewing modality for the screen size. But it is toggleable by the user as well. I won't show list view right now because I will essentially show that in just a bit. In addition, there is a link for a QR code, and if we click that, we get a QR code generated, and it'll show the content. There's some information about what the QR code does, so it'll show the content as is and not include any updates or changes. So this essentially creates a snapshot in time of what this content looked like at that time. So that's something to be aware of. And it will not show any options that you've hidden. In this case, we don't see the option to hide options because there's only two. But if this were a tool where there were 3 or more options, there would be X's in the corner, and there would also be an additional toggle on this side of the tool where you could select which options you wanted to show or suppress for whatever reason as part of the patient conversation. There's also an option for a permalink. So if we click that, we get a permalink here. And this can be added to the after visit summary or sent via the patient portal, things of that nature, to facilitate review of this content after or even before the visit if the use case is appropriate, all the while with the expectation that the patient will review this information with the clinician as part of making this decision. And then lastly, there's an option for a PDF. And if we click on that, we are taken to an in-screen PDF with kind of the default view that is familiar when you're looking at a PDF. And this also highlights a list view of the content. So you can see here that now the FAQs appear as row headers, and then you have sub headers of no statin, another row header of another FAQ, what is my risk of having a cardiovascular problem, and then that is repeated. So the FAQs are shifted to be row headers, and that's to accommodate fitting on a standard piece of paper. So this is a standard PDF, and you can see that there are options to go back to the tool if you're done here. And there are also the common buttons that you'd expect to have of being able to print this if you wanted to hand it to the patient, or you can download it as well. And one thing I've not yet mentioned, but is worth mentioning, is on the data input page and the assessment and guidance page, we talk in clinical jargon. We are okay with speaking and our content referring to things with clinical language because the intended audience there is the clinician. But by the time you get to the icon array, you may notice that we start to simplify the language. And that's because a key component, a key idea of the icon array is to facilitate a shared decision-making conversation between the clinician and the patient. And then for all option grid content, we make that content able to be understood at a 6th grade reading level or less. And we actually test against that and have plain language experts who help with review and editing of our content to meet that goal, to make sure that it is understandable at a 6th grade reading level or less. So that's it for a brief overview of DynaMed Decisions tools. We hope this was helpful, and certainly if you have any other questions or would like to get in touch with us for any reason, do not hesitate to reach out and we will get back to you as soon as possible.